Let's start off with Congresswoman Bono. Would you start our presentations?
Yes, Governors, good morning. It's really wonderful to be here with all of you, and especially to see my former colleague, Asa Hutchinson. Asa, it's great to see you. And Governor Beshear, thank you for testifying before my committee a couple of years ago. If I remember, I was extremely kind to you at that time, and I'm hoping you'll return the favor to me now that I'm on this side of the microphone. So my gavel was very light that day, and I'm without a gavel now, but it's great to see you. So I do want to thank all of you for taking an interest in this topic, and I'm honored to be here to share with you my thoughts on the opioid crisis. So I applaud you for focusing on this deadly epidemic, and I encourage you to throw everything you can at it. Countless lives hang in the balance. The hush-hush nature of opioid overdose deaths has for far too long been preventing the serious public health issue from receiving the urgent attention it needs. But I'm here with you today as both a former elected official who spent almost a decade focused on prescription drug abuse, but I'm also a passionate parent and family advocate who has personally wrestled with this complicated and extremely painful issue. So just like far too many parents, my introduction to this problem started in my own home. As a full-time working mom, as a member of Congress, and I knew my amazing son was grappling with some issues, but I didn't really understand all that they were and what he was going through. So one day while I was in Washington for votes, I received a call from my son who said, "Mom, I need your help. I've become addicted to pills." You can imagine how that felt. I still thank God for that call, and I consider myself to be one of the lucky ones who received such a call. But I grieve with the many parents who weren't as lucky as I was. But that phone call was just the beginning of a very tough road for our family, and it was a journey that we made public by doing national television and print interviews. After that, my office and I became somewhat of a beacon for other parents going through either the immense grief of losing a child or even a parent simply pleading for help. To this day, I credit my son for his courage and his compassion for speaking out himself and for allowing me to do the same. I've developed a very special passion for our youth and their susceptibility to addiction when they face powerful drugs that we've all seen happening too often. Shortly thereafter, Congressman Hal Rogers of Kentucky and I joined forces to create the Prescription Drug Abuse Caucus. It continues to grow in numbers today as more members of Congress, just like our governors, confront what was previously an unknown and silent killer in their districts. Many solid strategies are emerging to deal with this crisis, and there's not one that I've read about that I disagree with. There are widely agreed upon strategies such as the robust, real-time use of prescription drug monitoring programs, access to naloxone, research into personalized medicine, and Good Samaritan laws, and I support them all, but I'm going to focus my thoughts on a few other things. First, in addition to supporting community-based prevention and education efforts, it cannot be overstated that there is a need for strong messaging from leaders like yourselves about the dangers of the abuse of medications as well as illicit drugs. We hear an awful lot about avoiding gluten and saturated fats and cigarette smoke and artificial sweeteners and more, but we're simply not hearing enough, if at all, about thinking twice before we pop a pill. But educational efforts can't stop there. The medical community needs far greater education about the diversion of these powerful drugs, as well as the disease of addiction. Look, I know that the new terminology is substance use disorder. Pat and I were talking about that, but I can't break away from saying addiction and addict, so forgive me, and I use the two interchangeably. But for quite some time, there have been some who've denied any role in the epidemic, but that thankfully seems to be changing. Physicians and other providers are on the front lines of this issue. Providers, particularly those who treat a high percentage of patients suffering from any form of pain, must have the latest treatment guidelines, including the use of monitoring tools for high-risk patients. And while they must continue to make sure their patients have access to clinically necessary and beneficial treatments, it should be an ethical, if not a legal obligation, that they guard against their abuse. Secondly, we need to finally and fully overcome the stigma associated with recovery. Those in recovery need full support from their family, their friends, and from society as a whole. And recovery needs to be easily accessible with affordable options for anyone seeking help. The Hazelden Betty Ford Foundation has a program that they have created called Core 12, which stands for Comprehensive Opioid Response with the 12 Steps. And I personally consider it to be the gold standard, and I encourage you to look into it. I know from experience that there needs to be a far greater understanding of treating addiction. The notion that we can get somebody into rehab and they're going to emerge 30 days later as fixed or cured, while hopeful, it is not the reality. It takes seriously hard work and dedication for both the individual and the family. And if a relapse should occur, it should be seen in the same way we look at a recurring cancer. It's sad, but it's true. It shouldn't be stigmatized, and we should reach out to anyone who needs support. That recovery should include doing all we can to promote and establish recovery schools and sober housing for college students. Once a young person can leave rehab or a step-down environment, there should be safe and supportive options for them to enter. And that support should last a lifetime. I'd like to invite each one of you to participate in the Unite to Face Addiction Rally on October 4th on the National Mall. If you're interested, you can find out more information about it at facingaddiction.org. I'm going to be there to show my support for everyone and anyone in recovery. Recovery deserves celebration, not stigma. The last point I will make today concerns the importance of collaboration and partnerships. I've been reading what many of your states are doing, and I applaud each of you. But together with CADCA and the Trust for America's Health, I have created the collaborative that was mentioned earlier. We called it CPOP, an Collaborative for Effective Opioid Policies. We formed it to help bring all involved parties to the same table. We are healthcare providers treating patients with pain, family members who have lost a loved one to an overdose death, law enforcement officials addressing the problem on our streets each and every day, treatment centers helping people rebuild their lives, and medicine manufacturers who are striving to make treatment safer and tamper-resistant. The collaborative seeks to stem prescription opioid abuse without limiting patient and physician access to such vital treatments. We need an important meeting of the minds in order to advance solutions. I invite each one of you to join CPOP. We could really use your help and support. And then each one of you can ask and should ask how the many, many federal agencies who are charged with controlling drugs could allow this to happen on their watch. The Congressional Prescription Drug Abuse Caucus could really use your support with that. To sum up, I once saw a really good video about the pill mill problem in Florida. The reporter summed it up in a way that really struck me, and it went something similar to this. Imagine that 100 dead dolphins washed up on our beach every day. People would be outraged and demand action. Now imagine that continuing day after day, year after year. But this isn't about dolphins washing up on the beach. It's about our kids and it's about our families. Imagine them washing up on our beaches. So we must throw everything we can at this epidemic. I thank you for listening, and I stand ready to answer your questions and also anything I can do at any point in time to help any of you with this task. Thank you very, very much for allowing me to speak today.
Thank you, Congresswoman, both for your work while you served in Congress and continuing that work up to today. It's important, very important.